A modern hospital isn't just a building. It's a confusing city with its own language. You see signs like HDU, Triage, and Oncology, and it can feel overwhelming, especially when you or a loved one is sick. Today, we are going to decode the hospital. I'm going to walk you through exactly where you go, why you go there, and what those acronyms actually mean, so you never feel lost in the system again. The first thing to understand is that there are two ways to enter the system, and it depends entirely on how sick you are. Route 1. The outpatient. If you walk in on your own 2 feet, usually for a checkup or a specific problem, you are an outpatient. This means you're not staying the night. You'll head straight to registration and wait for a consultation. Route 2. The emergency. But if you are rushed in, maybe by ambulance or in severe pain, you skip the queue and go to Casualty or the ED. You might see older signs saying Casualty and newer ones saying ED. They serve the same purpose. If you see ED, know that it's the red zone for immediate life-saving care. Now, regardless of how you enter, you will likely pass through triage. Many patients get frustrated here, thinking it's just a waiting line. It's not. Triage is a safety filter. The nurse checks your vitals to decide who needs the doctor first. In triage, we don't treat first come, first served. We treat sickest served first. Sometimes, the doctor sends you to the detectives. These are the units that find out what is wrong. First, the laboratory. This is where your samples, like blood or urine, are analyzed to find the infection. Or you might be sent to a specialized clinic. Dental, which focuses strictly on your teeth and gums. Optical, which is specialized care for your eyes and vision. Or Oncology, the dedicated unit for cancer treatment and chemotherapy. Note that these specialized units often run on specific days, so always check the schedule before you go. Now, if the doctor decides you are too sick to go home, your status changes. You are now an inpatient. You will be admitted to a ward. We separate them for safety. Maternity is strictly for mothers and babies. Orthopedic is for bone and joint injuries, like fractures. And we keep surgical patients separate from medical patients who are fighting infections. Now, this is the part most people confuse. What if a ward isn't enough? We have a ladder of care. Step 1. The ward. You are stable. You take your meds orally, and you can walk around. Step 2. The HDU, High Dependency Unit. You are too sick for a general ward. Maybe you need constant oxygen or a nurse checking you every hour, but you don't need a machine to breathe for you. Step 3. The ICU. This is the top of the ladder. Life support, ventilators, one nurse to one patient. Finally, we have the specialized action rooms. The NBU is the ward for babies. Don't panic if your baby goes here. It's often just from mild cases like jaundice or feeding issues. Critical cases go to the NICU. Then there is dialysis. This is for patients whose kidneys have failed. The machines here clean the blood because the body can't do it anymore. And finally, theater. This is the operating room, a sterile fortress for major surgery where no street clothes are allowed. So, from the front door to the sterile lights of the theater, every room has a purpose. Now that you know the places, what about the machines? In the next video, we'll break down the difference between an X-ray, a CT scan, and an MRI. Stay tuned.